Good morning, everyone. My name is Jennifer Sanchez, and thank you all for joining this Zoom session to hear my health education theory webinar. My presentation will primarily be on the social capital theory, but before getting into that theory, I would like to discuss theories in general. So what are theories? Below are two definitions of theories. One is that a theory is a set of interrelated concepts, definitions, and propositions that present a systemic view of events or situations by specifying relations among variables in order to explain and predict the events of the situations. A simpler definition is that a theory is a systematic arrangement of fundamental principles that provide a basis for explaining certain happenings of life. From those two definitions, I would summarize that theories are descriptions of what is supposed to happen or what is possible. Next, let's explore why are theories important. Theories are important because forming them is involved in all thinking, and they often influence how research is collected, analyzed, understood, and used. Also, I would like to cover the importance of using theories in health education. Theories assist health educators as they tackle many challenges like needs assessments, program planning, program implementation, program evaluation, coordination of services, and communicating needs, concerns, and resources. According to our textbook, theory helps health education specialists plan, implement, and evaluate programs. Now let's get into the meat and potatoes of this presentation, social capital theory. You might be asking, when was this theory developed and by whom? Well, after a bit of research, I found that the term social capital dates back to the 1980s and is primarily from the work of Pierre Bourdieu, James Coleman, and Robert Putnam. These three individuals did not work on the theory together, but nearly simultaneously introduced the term around the same time. The theory started being used in health education a decade after its development in the mid-1990s. Social capital theory has been defined as the relationships and structures within a community, such as civic participation, networks, norms of reciprocity, and trust that promote cooperation of mutual benefit. Some believe that social capital arises from the human capacity to consider others, to think and act generously and cooperatively. It relates to social relationships and social structures. It involves people knowing each other and having positive relationships based on trust, respect, kindness, and reciprocity. I want to sidebar for a minute and say that during undergrad, I double majored in political science and philosophy, so I'm pretty familiar with the social capital theory since it got its start in political science. When I think about social capital, the word reciprocity is immediately what I think of. Reciprocity is the practice of exchanging things with others for mutual benefit. So essentially, I will scratch your back if you scratch my back. We especially see reciprocity privileges granted by one country or one organization to another country or organization. Some real-world examples of this include the agreements some countries have to honor driver's licenses, marriage licenses, and if crimes are committed, extradition agreements with other countries. Another example of the idea of reciprocity is when citizens like you and I pay taxes to the government. By us paying taxes to the government in return should be using those taxes to offer us services like safe driving roads, free public education, health coverage for the elderly, and so forth. Now, back to the presentation. So I would like to cover this social capital Venn diagram. Just in case anyone forgot, Venn diagrams use circles to show the relationships among things. The circles that overlap display commonalities, while circles that do not overlap do not share those traits. So on the left side, we have networks, and those networks are comprised of bonding, bridging, and linking. Then on the right side, we have norms and expectations. When both sides come together in the middle, we have trust and my all-time favorite, reciprocity. So all human endeavors are linked to social capital. Some other examples of social capital include educational attainment, public health, lower levels of crime, economic and business performance, career success, and innovation. Social capital can contribute to the field of health promotion by adding new knowledge on how social network interventions may best be designed to meet the needs of target groups. It provides a useful framework and starting point for what constitutes health supporting environments and gives guidance on how to achieve them, and can provide new ideas about the processes that influence human interactions, cooperation, and community action for health promotion. Also, increasing social capacity is easy. You can increase it by being helpful and giving, by getting to know people, by strengthening your existing relationships, and by forming new relationships, and by being trusting and being trustworthy. Well, it sounds easy in plain terms, but practiced, it can be easy. So, according to a health research study, social participation in networks are associated with healthy behaviors. High levels of trust and reciprocity were associated with non-smoking, adequate duration of sleep, and daily consumption of vegetables. High levels of social capital in communities can influence health through the spread of healthy norms. Currently, public health departments and health educators are having to increase their social capital because of the COVID-19 pandemic. Individuals who are afraid and uninformed are reaching out to public health departments for information, and a lot of that information is educational. Many are asking, what are the COVID-19 symptoms? Where can I get tested? What is a test like? What happens if my test comes back positive? When is the vaccine being released? What is the difference between COVID-19 and the flu? And a multitude of other questions. As a result, health educators are at the forefront of answering those questions and building trusting relationships with the public like never before. And here are a list of my references. And with that, this concludes my health education theory webinar. With the few minutes we have left, does anyone have any questions?
Great job, Jennifer. I do have a question, but I will wait and see if anybody else does first.
Sure.
Yeah, I have a question about the study that was in regards to the non-smoking and the sleep levels and the eating vegetables. Where was that study done? And is social participation actually something that does lead to healthy behaviors, you feel?
That's a good question. So from my memory, the study was done in Finland, so it wasn't done here in the US, and it was done in the early 2000s. It was just a general health questionnaire that was put out to the public, and they got a lot of participation in it. In my opinion, I believe social participation does lead to healthy behaviors if you socialize with healthy people. I think, we hear monkey see, monkey do. And like, for example, when I go out to eat, if the person I'm with orders water, I'm going to order water. I don't want to be the one ordering a beverage like a soft drink, a sugary soft drink. And, if someone orders a salad, I'll cry inside, but I'll also order a salad. And with that said, I really do think healthy behaviors from social participation depends on who you're socializing with. If you're hanging out with healthy individuals, those healthy behaviors are likely to rub off on you. But if you're hanging out with individuals that, participate in unhealthy behaviors like smoking or using illicit drugs, those behaviors are likely to rub off you because of peer pressure and, other things.
Yeah, that was a great answer, Jennifer. I think so. Research on this theory in terms of health specifically has shown that it's really difficult to actually empirically connect health outcomes and health behaviors to having social capital. In the same way that social network is kind of difficult. So causation hasn't necessarily been proven, but this idea of social capital does appear to have a positive impact when that social capital is positive, just like you said. Great job. So one other question. So you're the first to use COVID-19 as an example. And I love that you did, because this is a public health issue that everybody's dealing with right now. So I think that we could think of all of our theories in the lens of COVID-19 and really help to sort of understand. My question is about, so in general, right, we have social capital when we have this sort of trust. And you're talking about social capital in terms of reaching out to our public health departments and getting information and that kind of thing. But how can we as public health professionals, or even just community officials, kind of increase this positive social capital? What I'm seeing a lot is that there is sort of a distrust of people, of their government right now, of medical professionals. There's so much false information flying around and just so many misconceptions. So how can we use your theory to build trust and reciprocity when that seems to really be an issue in COVID-19 right now?
That is another great question. I think that COVID-19 is also unique in that we shouldn't really be networking one-on-one during this time. So, how do you reach them without necessarily being right in front of them? So I think that social media campaigns directly from the source would be a great way to get information out there. Mailing educational information to the public would also be a great way to share information. We do have the task force set up for the governor for COVID-19, so they need to make those appearances, those daily appearances, known to the public. Report on it, get to the news outlets, do more press conferences. Tennessee right now is listed as one of the states that has the highest, like top 5 positive rates in the US, but what individuals don't understand that other people from other states are coming to Tennessee for free testing. So that's why we have people from Kentucky, from Alabama, even from Georgia that are closer to Tennessee borders coming for that free testing. And that's a big reason why our rates are so high. So, getting that good information out there from the source, from a reputable source, like a state epidemiologist, would be a great way to earn the public's trust and get, our face out there.
Good. I like the idea of including an epidemiologist and public health professionals in those sort of sessions that the governor does on a regular basis. And maybe even town halls would be helpful, like a virtual town hall, to get people's questions answered so that everybody can sort of be on the same page. Yeah, good idea. We should put you on the task force.
I work with a lot of people on the task force, but they've got more work to do.
Okay, awesome job, Jennifer. I'm going to stop asking you questions. You did great. Just don't forget to submit the link to your webinar to the Dropbox and the discussion forum. And have an awesome Saturday. Thanks to the attendees for coming.
Thank you. Have a good rest of your morning.
All right, thanks. Bye.